Hello everyone. Thank you for joining this free demo lecture on OBGYN ultrasound. My name is Dr. Shabana Umar Siddiqui, Director of Dr. Shabana School of Sonology. Teaching is my passion. After completing ARDMS and fellowship in academic ultrasound from Thomas Jefferson University, Philadelphia, I started this institute as Dr. Shabana School of Sonology, where I train doctors and professionals working in the field of radiology. In addition, I also conduct preparatory classes for ARDMS examination. And by the grace of Allah, we have maintained a 100% success rate so far. Today, I'll give you a small introduction to how I teach ultrasound in my online classes. I strongly believe that a teacher must be honest with their profession. That is why everyone who has taken classes from me knows that registration with me is a lifetime registration. I never leave my students at any stage of their professional life. My cooperation is always there whenever they need guidance or advice. I believe in maintaining a strong bond with my students, just like a good mentor or a friend. So, now let's proceed to today's demo class. Today our topic is first trimester ultrasound. In this session, we will discuss a systematic approach to first trimester ultrasound, which is one of the most important ultrasound to scan in obstetrics. By the end of this lecture, you should be able to understand how to examine a first trimester pregnancy systematically, and how to identify normal findings, and how to recognize some early abnormal findings. When a patient comes to us for the scan in early pregnancy, they come to us with the history of amenorrhea and they want to confirm pregnancy, if they are actually pregnant or not. Then we have to confirm pregnancy, and then we have to see if it is a single or a twin pregnancy. Then, is the pregnancy viable? Then determine accurate gestational age and detect early pregnancy complications and to diagnose ectopic pregnancy. Always remember that CRL measurement in the first trimester is the most accurate method of dating. So if a patient comes to us with many reports and there is a discrepancy in all the reports, then we have to decide the gestational age by the earliest report. And the earliest report is most reliable in deciding gestational age. Indications for the first trimester scan. Common indications for performing a first trimester ultrasound include: patient comes to us with amenorrhea, so they want to confirm whether they are pregnant or not. They come usually with amenorrhea and vaginal bleeding. Sometimes amenorrhea is associated with pelvic pain, and sometimes there is a suspected ectopic pregnancy and history of previous miscarriages. And they also come for the dating of pregnancy. Usually first trimester ultrasound is performed between 6 to 12 weeks of gestation. Systematic approach. We should always follow a systematic approach. Whenever you scan a first trimester pregnancy, look for these structures in order. Number 1 is the gestational sac. Number 2, yolk sac. Number 3, embryo or the fetal pole. And number 4 is the cardiac activity to see the viability of pregnancy. If you follow this sequence, you will rarely miss important findings. Now I'll talk about gestational sac. The first structure that we usually identify in early pregnancy is the gestational sac. Here you can see an image of gestational sac. In this image, you can see a cystic structure in endometrial cavity. And here you can also appreciate double decidual sac sign. The gestational sac is measured from inner to inner, right? It is measured from inner to inner. That is, only the fluid part of the sac is measured. The thick wall surrounding the gestational sac is called decidua capsularis, and then this hypoechoic area is endometrial cavity, and this surrounding thick wall, another thick wall, is called decidua parietalis. So in this case, you can see a gestational sac with double decidual sac sign. Normally, gestational sac appears as a round or oval structure, anechoic structure, within the uterine cavity. One important sign that confirms the intrauterine pregnancy is the double decidual sac sign. Here you can see an image showing double decidual sac sign. You can see decidua capsularis surrounding the gestational sac, and decidua parietalis and the endometrial cavity in between. So this is the main point of identification of a gestational sac. When the embryo is not yet visible, we can measure the mean sac diameter to estimate gestational age. Then is the yolk sac. The next structure we should identify is the yolk sac. The yolk sac is usually the first structure seen inside the gestational sac. Here you can see in this picture the fetal pole and yolk sac along with gestational sac. Yolk sac becomes visible at approximately 5.5 weeks of gestation. Normally the yolk sac is round, well defined, and less than 6 millimeter in diameter. If this yolk sac is enlarged or irregular, then it can sometimes indicate a poor pregnancy outcome. Then is the embryo or the fetal pole. The next step is to identify the embryo, also called the fetal pole. The embryo usually becomes visible at around 6 weeks of gestation. At this stage, we measure the crown rump length, which is also called CRL. Here you can see a picture showing gestational sac with the double decidual sac sign, and in the gestational sac you can see this echogenic focus, which is the fetal pole. and fetal pole is measured from one end to another. CRL is extremely important because it is the most accurate method of dating pregnancy in the first trimester. So CRL is measured from crown to rump. Okay, so it excludes any other structure like limbs or umbilical cord or any other thing. So it is measured from one end to another only. Then is the cardiac activity. After identifying the embryo, the next important step is to check for the cardiac activity. Normally, fetal heart activity becomes visible at around 6 weeks of gestation. The fetal heart rate increases as pregnancy progresses. For example, around 6 weeks of gestation, about 100 beats per minute is the heart rate, and at around 8 weeks, it is about 150 to 170 beats per minute. The presence of cardiac activity confirms viable pregnancy. There is the diagnostic criteria for the pregnancy failure, which is very important. Every sonographer should also know the diagnostic criteria for pregnancy failure because incorrect diagnosis can lead to serious clinical consequences. What are the important criteria? If we see a CRL is equal or more than 7 millimeter, but there is no cardiac activity, and if mean sac diameter is equal or more than 25 millimeter with no embryo, if these criteria are present, the pregnancy is highly suspicious for pregnancy failure. Common first trimester abnormalities. Let's briefly discuss some common abnormalities seen in early pregnancy. One example is an embryonic pregnancy where a gestational sac is present but no embryo is visualized. You can see that gestational sac is there and gestational sac is irregular, but there is no fetal pole, there is no embryo. So we call it an embryonic pregnancy. Another common finding is subchorionic hematoma, which appears as a hypoechoic collection adjacent to the gestation sac and is often associated with vaginal bleeding as well. Here you can see a gestational sac in this picture, and it is surrounded by this hematoma, which is called subchorionic hematoma. Here we can measure the length and width of hematoma. And of course, one of the most important diagnoses to exclude is the ectopic pregnancy, if the pregnancy is intrauterine or not. Here in this picture, you can see the uterus. Uterus is there. Endometrium is thickened, showing decidual reaction, but there is no gestational sac. And if we look for the gestational sac in the surrounding adnexa, we can see this gestational sac with double decidual sac sign, which is easily identified. Now let's have a case discussion. A patient presents with 6 weeks of amenorrhea on ultrasound, and we see a proper gestational sac, yolk sac is there, embryo is also there, which measures 4 millimeter, and cardiac activity is also present. So what is the diagnosis? This represents a normal intrauterine pregnancy of 6 weeks. Now, the most important part is how to report it. Finally, proper ultrasound reporting is extremely important. A typical report may say, single intrauterine gestational sac is seen, yolk sac and fetal pole are visualized, CRL measures 6 mm, which corresponds to approximately 6 weeks of gestation. Fetal cardiac activity is present, so the impression is single live intrauterine pregnancy. Now, I would like to show you a few cases. It's a case of 11 weeks of gestation, and you can see fetal head, body, upper limb, lower limb. Fetal movement and cardiac flicker is normal, and you can see that placenta is developing here. It is mainly fundal here, a little on the anterior wall and a little on the posterior wall. And this is the CRL of fetus. This is fetal head, body. So we measure it from crown to rump like this, and it is 3.9 centimeters. And mind it that we have to exclude any fetal parts like limbs or cord or any other thing like yolk sac to measure CRL. It should be from fetal crown to rump only, the whole length. So it is 3.9 centimeters and it corresponds to 11 weeks of gestation. Here you can see placenta is developing here. This is the cervix. The whole globular structure is cervix, and this tubular structure with this echogenic midline is vagina. So everything is fine, and follow-up scan is advised after 2 weeks to see further progress of pregnancy. It's a case of 5 weeks of pregnancy, and here I want to show you double decidual sign. Here you can see one echogenic line and another echogenic line is here, and in between these two echogenic lines you can see this hypoechoic area. So it's a double decidual sign of early pregnancy. It's a case of early pregnancy, and according to her LNP, she should be 6 weeks pregnant. But here you can see a gestational sac only with this yolk sac. You can see the yolk sac here, but no fetal pole is seen here. and gestational sac measures 1.2 centimeter, which corresponds to 5 weeks of gestation. So there is a difference of 1 week. By LNP, she is 6 weeks pregnant, and by scan she is 5 weeks pregnant. So follow-up scan is advised to see further progress of pregnancy after 2 weeks. It's a case of diamniotic twin pregnancy, and CRL of twin A is 1.9 and twin B is 1.8, and they both correspond to 8 weeks of gestation. It's a case of 7 weeks of gestation, and here you can see the gestational sac with this fetus. And you can appreciate the cardiac flicker here. This is the yolk sac. This one. This is the whole fetus. And you can see another hypoechoic rounded area here, which looks like a seedling fibroid, and it measures 2.0 centimeter. This hypoechoic structure is a seedling fibroid. Here I want to show you the cervical canal, cervical length, and you can see the internal os here, external os, and its length is 3.2 centimeters. Anterior wall of cervix, posterior wall of cervix, and this tubularis vagina. And here you can see the whole uterus.